So one of my coworkers, the one that actually had the nursing background, was the more seasoned infection preventionist of our team. Um, and when my current boss retired, the job required a master's prepared individual in either a master's of nursing or a health related field, and public health met that requirement. Now, I was only there for, I think, a year and a half, 2 years, but I was the only one that had a master's under my belt. So technically, if I wanted to become the director of that department, I was able to take that position. However, understanding that as a new IP, 2 years, you're barely getting your feet wet in infection prevention, right? So I didn't push back. In fact, I told the nurse, that she was interested in the position, and I said, I'm not going to fight you for it. I think it makes more sense that you're in this role. Well, uh, that actually, I think, solidified our friendship. We've been great friends ever since. She's a system director at a neighboring health system. I'm a system director, so it all works out great in the end. But I still learn from her to this very day. Um, but in terms of my personal progression, after she became my boss, I actually took an opportunity to become a manager at a different health system, a manager of infection prevention. So it was a smaller facility, just a couple IPs in the department, infection preventionists in the department. But I used that opportunity, and at the time they called it a working manager position. So you were an infection preventionist, but you were also helping to manage the department. So that's kind of how I started into my administrative role, and I did that for a number of years, and was able to, I guess you could say, climb the ladder from that point.